Hello and welcome back to Views from the Frontlines, Maryland's mental health crisis. I'm John Aaron and I'm joined by Dr. Marissa Leslie, Medical Director of Compass Health Center, Maryland, Dr. Holly Mears, who leads the emergency medicine and hospitalist teams at Holy Cross Health, Ann Redmond, school counselor at Thomas S. Wooten High School in Rockville, and Maryland State Senator Will Smith, a Democrat from Montgomery County. We're talking solutions in this segment. Senator Smith, you mentioned that there's the mental health issue, there's the criminal justice issue. Is there political will to get these issues solved or at least improved upon?
There is. As awareness has grown, so too has the political awareness within the political class, I should say, or within folks that have been elected. One of the things we were really focused on is breaking down the silos, because a lot of government agencies and even the different branches of government are doing their own thing, but not working together. And so more recent developments have included areas in which the Governor's Office of Crime Control and Prevention, the Judiciary, Chief Judge Fader, our Supreme Court Justice, has launched an initiative to address these issues. And obviously we in the legislature have leaned forward in passing legislation to help build this framework to help for better treatment in the future. But there's also more opportunity to collaborate with our private sector partners, or with the Hospital Association, with our public schools, and with places like Compass, who help gap fill. Government can't do everything, and nor should it. And like I keep talking about that 1 million that lack access, places like Compass help bridge those gaps, provide those telehealth services, and can be all across the state. We can have better understanding of what's happening in our public school system, so we can support our peers and our mental health professionals that work within the public school system. And we can work with the hospitals to understand what's happening, because obviously it's a huge driver of cost when you have someone seeking mental health or substance abuse at an emergency room facility. That's a huge driver of insurance. It has a cascading effect on the entire system. So not only breaking down the silos within government, but working with our private sector partners as well.
To our other panelists, you have Senator Smith here, who can help make change happen. What changes do you need to see? What sort of red tape is in the way? What sort of policies need to be put in place? Ann, do you have any thoughts?
Well, one of the things I definitely want to thank you for is all the work that all the different levels of government has done to bring that Bridge to Wellness Center into our schools. Because of that, which is run by the Department of Health and Human Services, so it's not an MCPS entity, but is being run in conjunction with them. So we're able to bring those services directly to the students. That's amazing. That's a big deal. Giving us enough funding that we can have social workers in our schools. So now when we have a parent who's concerned about insurance and cost and how to navigate that, there's somebody right there in-house who can meet with that family member right then and there. And it might take a little bit of time to find the answer, but they feel supported. Just to continuing to do that, and to continue to, as you guys have been doing for us in recent years, continuing to make more staffing available for us with school counselors too, to bring that ratio down. We're very lucky in Montgomery County Public Schools in that our ratio is fairly close to the desired 1 to 250 students, but there's some places in the state of Maryland that's like 400, 500 kids per school counselor at the high school level, and that's just too much to do what we need to do. So continue to do that, and we need to continue to support you all when we go out and we vote.
You have to look after 250 kids?
I have 250 kids. I actually have 260, but very close to the 250, but yes.
How in the world do you keep tabs on them?
You spend a lot of time and a lot of organization, and if you don't have organizational skills, you develop them. But I also have a fantastic team, and one of the things that Montgomery County Public Schools is trying to do is to give us that ability to have that team so that you're not in it by yourself. As we all know, in order to really support students or anyone, you need to have that collaborative approach. So it's not one mind, is several minds coming from various different backgrounds that makes that difference.
Sorry, I just found that very, very impressive that you could do that. That was a bit of a sidebar. Back to the issue at hand. Dr. Mears, you're advising Senator Smith right now. What sort of changes would you like to see? What sort of improvements could be made?
I think just having more, for me in the emergency department, the patients that I see, so many, need hospitalization, and just having more venues for patients to be treated so they don't have to wait in the emergency department, just to try to have that throughput and make people get the care as quickly as possible.
And Dr. Leslie?
Well, how long do we have? A few things. So I think insurance parity is important. I think being able to pay for the services so that the care can be high quality, like it is at Compass Health Center, is important. Payers really don't pay as well for mental health, and so it should not be a game, in our opinion. In addition to that, I think helping the workforce. I'm a physician and I work with very talented group of mental health professionals, including social workers, licensed professional counselors, nurse practitioners, and it's not always attractive to come into our field, but I do think creative ways to help the workforce, loan repayment and whatnot, can help people feel comfortable and not feel like they can't afford to pay their student loans by entering our field, either as a psychiatrist or a social worker or professional counselor or a nurse. I would say, just in general, making it easier to collaborate and easier for individuals to seek mental health care, having multiple venues like Dr. Mears is saying. But again, I think I have to go back to insurance because it is a huge barrier and it serves as a limitation. So it's a hard one. I think what I was struggling with is, what do you do with people who are entrepreneurs and have private practice and just want to take cash only? But perhaps if we made it more attractive, then there would be more venues. And then finally, telehealth. The pandemic really highlighted the importance of telehealth, or the ability of telehealth. Compass Health Center offers telehealth, like you mentioned. I think it's important to keep telehealth a viable option. In the past, the payment for telehealth was so poor and low, it really wasn't offered. But telehealth, it's not all or another. It's not in-person or telehealth. I do think having availability is really important. Compass Health Center and other centers are able to serve people in rural communities who can't come to our physical location in Silver Spring because of distance or because of a medical illness. And we're able to deliver that same high quality care because telehealth is still such a viable option.
All right, Senator Smith, you're off the hot seat. Sorry to put you there, but I think there were some interesting points made. Anything that you have in response that you'd like to weigh in with?
No, just that it's enlightening. This is why these conversations are so important, because you get to kind of cross-pollinate and hear what other folks are doing, and you get to hear from experts that deal with patients every single day in multiple different venues. For the policymaker, that's invaluable input. And so as we move forward in the years ahead, I look forward to collaborating further with all of you and making good policy, making Maryland the #1 state for mental health treatment.
Seems like something that everyone can do is work on the stigma that we had heard mentioned earlier. How do we do that? Do we simply talk about this more? Is that the solution? Anyone want to jump in?
I think it is. I think that at our hospital at Holy Cross, we have really tried to work on training all kind of providers and everyone who works there to try to help. An example is that we have a military sensitivity training program that we go through that, someone who has a military background may have, a different perspective, and so we have the sensitivity to deal with someone who has that background when they present to the hospital. But also, too, I had a security guard that someone was getting upset, and then the security guard just had all these de-escalation techniques to try to help and sort of just make someone as calm as possible, just to take the intensity out when possible, to try to let people have time, take a breath, and get the care they need.
And how do you fight that stigma at the high school level?
Montgomery County Public Schools is embedding wellness lessons in their activities every week. Different schools do it different ways. At the high school, it's usually an advisory period where we're teaching them specific skills, things like mindfulness and time management and little things like the negativity bias that we naturally see one negative thing and it takes 5 positives to offset that, and how can you actually try to look for those positive things. But we embedded that in the day so that the students know that this is important. It's important enough to stop and talk about it. And with time, it does start to make a difference. When we first started, the kids were like, why are we doing this? It's not on my report card. And it was like, because it's important. Physical health, mental health goes hand in hand. You got to plan for them. And so we just keep chipping away at it, and we're starting to see kids coming down and saying things like, I tried the 5, 4, 3, 2, 1 technique. Do you have anything else I can do to center myself? It's like, this is great. So we just need to continue to do that.
Are there any other changes that we haven't mentioned that could be made to help people access care, to make that care more effective, to make that care more affordable?
I mean, briefly, just the stigma topic, I think it's important to start with yourself and to think that mental health is something that needs to be maintained. It's not something you just address in a crisis. Think about, how burned out are you maybe at work or with your family, and how do you stay mindful and present? But other things to help improve access, again, being vulnerable about it, honest about it, and talking a lot about it. I think we do learn from each other who's a good pediatrician, who's a good family physician, what's the best restaurant. It's kind of sad that we're better at recommending restaurants than we are at healthcare. But if we talk among ourselves in community, in our churches, our mosques, our synagogues, our book clubs, then it destigmatizes it and it educates and helps improve access by improving knowledge of what the resources are and what's out there.
Senator Smith, is the solution to this at the state level where you are? Is it the local level? Obviously, it's probably a combination of that. Is the federal government to get involved? Who needs to step up here?
Well, it's going to take all of us. But what I would say what the state level can learn from, for instance, an entity like the military. I mean, I'm still a reservist, and every month we go and we have something called the Plan of the Month. And there's a lengthy segment on mental health and resources right there. Every month, the commanding officers will talk about the importance of mental health and making sure that you and your seatmate and your soldier, to your left and right are doing well, and checking on your battle buddy. The state can learn from lessons like that by engaging in PR campaigns and public awareness campaigns, and it's particularly important within our public schools to make sure that it's destigmatized, but then people have access to the resources, they know where they are. But the more we talk about it, the better it'll get, and government can play a critical role in facilitating that conversation.
And correct me if I'm wrong, but unfortunately it doesn't seem like this is a big issue that gets people to the ballot box. Maybe it is, but it's not the economy. So, how do you make it relevant to voters? How do you sell it, basically?
Well, I think, there's been a premium placed on this issue, especially after the pandemic. I think we've all been more acutely aware of mental health, and I think it hasn't, it doesn't pull like with crime or the economy does, but it is interwoven into every single issue that we deal with as a society. And so it's incumbent upon all of us in elected office and professionals to raise awareness and to keep up the conversation, because it impacts every single one of us.
Well said. Thank you to all of you for joining me. My guests, Ann Redmond, Senator Will Smith, Dr. Holly Mears, and Dr. Marissa Leslie. You've been watching Views from the Front Lines, Maryland's mental health crisis. For more on this discussion, just go to WTOP.com and search mental health.